Hello guys, I'm here at the office and today I want to share a little bit of my experience. I saw a patient today that she came to me complaining about her profile. So on her profile she has a little hump and that bothers her a lot, and she says that she doesn't like to, she's not comfortable taking pictures in profile view. And on the tip, on the other hand, she thinks it's beautiful and she doesn't want to touch her tip. And actually, she has a very beautiful tip, defined tip, thin skin, and on the profile it's already projected and with a good rotation and a good nasolabial angle. So she's good on her tip, but she complains about her hump. Maybe some years ago, in this kind of patients, I would go for structural rhinoplasty, which is a very good option. I'm not saying that it's a bad option because we can have wonderful results with structural rhinoplasty. But try to think with me, okay? If you do a structural rhinoplasty on this patient, I have to do a cut here, I open her tip, I have to open her cartilage on the tip to reach her dorsum. Once I reach her dorsum, I need to resect her hump. When I resect her hump, I open the roof. And when I open the roof, I need to reconstruct it. To reconstruct it, I need grafts. So I go to the septum and I harvest grafts, and I need some material, I need some grafts to reconstruct it. So I use these grafts to reconstruct the dorsum, and of course I can reach wonderful results with that. But when I'm coming out of the nose, I have to do something on the tip because I open and I didn't preserve any ligaments and any of the original structures of her beautiful tip. So I have to put some grafts also on her tip and maybe stabilize it with strong grafts like septal extension grafts and not only strut grafts. So basically I use it spreader grafts, septal extension grafts, and sometimes because I open the tip and it's not so symmetric anymore, I have to do some little grafts, maybe articulated ring grafts or ring grafts in this tip. At the end of the surgery, it's perfect, it's good. But we know that in thin skin patients, after 1 year, 2 years, they can have scar contraction and the skin can be even thinner. And at the end, you have a nice result, but some irregularities or some distortions on the original anatomy because you reconstruct it. If we compare, for example, to a house, in a house, okay, you do the best work and that's gonna stay exactly the way you built it. But in the nose, it's not like that. In the nose, you have healing process, and sometimes you can have this kind of healing process that is out of the control of yours of the surgeon, and that means you can have irregularities that it's not your fault or it's not the patient's fault. It's just a process of the healing, natural process. So nowadays we can use some kind of preservation rhinoplasty concepts to do this kind of noses. So nowadays we can operate this nose really promising to the patient that we're not gonna touch her tip because we can access her dorsum without touching her tip, and we can access the dorsum without removing her roof. But instead of removing, we preserve the roof. We remove some strips on the base of her ceiling, and we treat her dorsum without touching and without creating a possibility of healing process here on the external part of the roof. So we treat the roof, under the roof, and this way we can reach a better profile without touching the tip also. That's a big advance for me because in my practice I can use this kind of philosophy or this kind of technique to treat this kind of patients that in the past I was doing more invasive surgery with more grafts to do the same thing I'm doing today. So again, I'm not saying that we have better results now, but maybe we have similar results but much less invasive, with faster surgeries, and important, with less chances of irregularities in the future, because you're doing less trauma to the nose. You're not reconstructing some structures, but you are preserving some structures. So that's what makes me very excited about these advancements that we have nowadays in rhinoplasty, and that's what I'm sharing with my students in the mentoring program. And I'm so excited to be able to offer to my patients this kind of different treatments, and in my opinion, in some selected cases, a better treatment for them. So see you guys next.